this episode of Nurturing Wellbeing with Kurt Kelly, we have a treat for you. We brought in a major player in the Florida Senate, Senator Sen Bean. He is the President Pro Tempore of the Florida Senate, and I think you're going to really enjoy this interview. Let's get to it. I'm with Senator Sen Bean of Fernandina Beach. I always have a hard time saying that word, by the way, but one of the coolest places in America to live. And so we're so glad to have you here. Aaron, thank you so much for being on with us today. I really appreciate you. I hope you're having a little restful time from the legislative session, because I know it was a challenge with all of the COVID issues. But we really appreciate the great work you did this year. I want our viewers to understand what it takes to do the work that you do, and even why you would jump into the public life, leave the confines of being a private citizen to step up and to step into the public life.
Kurt Kelly, you didn't give me time for opening statement. So let me make my opening statement first, and then we'll jump in. Kurt Kelly, it's great to be with you, and I just appreciate you. I don't know if your listeners or your members know, you can rock a microphone, and just listening to your voice, and you can do this too. You can close your eyes and hear voices that were on the House floor and remember where they sat and what issues lit them up. And when it came to kids and families, I just remember your voice. Mr. Speaker, I rise. Representative Kelly, you're recognized. And so it's good to hear your voice. It sounds great. And what a wacky year it was. It's a wacky year if you're in the kid caring for business. If you're in the legislative business, it was also a wacky year. For the first time in Florida history, no one was in the Capitol during our sausage legislative making. And it was just very surreal. And for anybody involved in the process, you know, it was different. That was the world we lived. And that was the science that when we launched, you know, the vaccine wasn't there. I miss it, though. I like people. People think, oh, you like what? Nobody there. Just like you, Kurt Kelly, I'm an extrovert. I get my energy being around people. And so being on Zoom all day wasn't my cup of tea. We also had a bonus. There's been 2 sessions since we last talked, Kurt Kelly, not only the regular session, but the special session. So hopefully we'll get a chance to talk about that and talk about the implications of what that means for your members. You know, it's funny. I'm termed out. How about that? I'm term limits. I'll be exiting. I'm not dead yet, but next year in November, I'll be exiting stage left. And I know some people are counting down the days, and others, you build relationship and friends, and just life changes. So it's a great day to reflect a little bit, but under no circumstances am I slowing down or giving up. We're actually pushing the throttle forward a little bit as you feel that a greater sense of urgency to get things done. And I've always had that. I think most legislators, Kurt, you've got it yourself. It's just in your DNA to serve. It's almost a strange addiction, because it would be so much easier not to do this. We would probably make more money doing something else. We would have more free time to do what we want to do. But I think your members have that same willingness to serve too, because you know, I know we don't pay caseworkers enough. We're going to talk about that. But even the CEOs and the upper leadership, they do a lot. And when I'm on the road, I see leadership at events on Sundays and just all over doing just fantastic work. And so it's in our DNA to jump in. And I've had again, not done yet, but I've had just a successful ride in the legislature. Love it. I know I'm going to miss it too, but just the people. But it's going to be exciting and scary to do something new.
You know what I also notice is a lot of times in the public life, people become sort of staid and kind of just, you know, everything is thoughtful and just, and while you're extraordinarily thoughtful, I just love your personality. You bring a sense of personality, and it's inviting people. I get you, man. I hear that this would have been a difficult session, because I do believe that many of the members love to meet with people and spend time with them. And I know it would be difficult to address all of the issues and get the input from it. Now, you were good. Even on our issues, I had several opportunities just to talk with you, and sometimes by phone, sometimes by Zoom, and we can communicate that well. But I think you had a challenge before you, and I appreciate what you had to go through.
Let me just brag on you and your members. And I usually don't brag on who I meet with or whatnot, but I'll point directly at you. I'm pointing at my screen to you, Kurt Kelly. You and your members changed the dynamic. When we first launched this past session, I had a bill that I thought was a direction that helps kids. I came from solely the what we can do. What can we do to help you help kids? And that was a bill that I did. There were a few different aspects of that bill. One of which was limited compensation. And there was several others. That was the main one that drew the magnet of people looking at that. Your members stepped up, and I met with several of them. We had an hour conversation when I brought in the full team to talk about it, solely because of you and probably 4 or 5 CEOs from around the state of child welfare. We changed that dynamic and said, you know what, this isn't it. Bob Miller in Jacksonville, I just remember his words. He goes, Bean, I'll find a way. Bean, I'll find a way. But who's it that's going to hurt my CFO? I can't get him. You're telling me I'm going to pay a Fortune 500 CEO the little amount that it's going to be a disaster. So, but for you, but for the CEOs of getting involved, and I know you're going to stress that getting involved, it truly matters. It truly makes a difference. And in that instance, it made all the difference.
Well, and you said it at the beginning, the sausage making. So we all understand that we put legislation together. I was guilty of this at times, thinking, well, this is the right way. And then you start hearing some nuances. And let me compliment you. I'll point to the screen to you. The reality is that you had the capacity to listen and say, you're right. Let's work on this area. Let's change here.
You're exactly right. But you just educated me. That's what you did. You said, let's look at it. But Mike from the Panhandle really just said, let's look at it from a different angle. And Kurt, here is our challenge. We get it right. We have some of the best child care. I think the system, the framework is among the best in the United States. Other states are coming to see us, but it would be easy just to say, okay, we're the best and that's it. But we've got to always seek to improve, I used to say, we get it right 9 out of 10 times. So I want to help that 10th. What can we do to improve the decision that we make for that 10th child? And it's actually smaller than that. It's not 10%. It's actually a lesser amount. But it's hard that when we make changes to help that very small percent that we need some tweaking, that we don't hurt the 95 or the 90% of what we get right. And that bill is a great example of how trying to help this little bit, hurt the others. But guess what? You and your members let us know we're in the wrong direction, and we fixed it.
And we appreciate it. And by the way, you are 100% right. There is no finish line in this work. We are constantly, we should always be striving to get better. Yes, Florida's system of care has come a long way from one of the worst. Jeb Bush was on a program we did not too long ago, and he said we were worst and we came to first. I don't know if we were the worst, and I don't know if we're first, but we're darn close, and we've made a lot of progress. But that's not just our membership. This is the part that I'm really working with our membership to understand. This is a we thing. And what I mean by we, it means that we're working with the Department of Children and Families, that we're really locking in with them and getting lockstep on things. And we have differences with them at times. And even working with the legislators. Frankly, that becomes the part that I remind our members that it's to our advantage to come in and sit down and have a thoughtful, reflective conversation about how we can get better and welcome the ideas and the change. And so, again, as I think I shared with you in your legislation, we welcome the change. I get it. There are some people that have certain opinions. Let's talk through that and see how we can work through it. And you did, and that is responsive government. And I just want you you and the president of the Senate, Wilton Simpson, I appreciate the way that he allowed for us to have those conversations. I mean, literally, he could have shut us down. He could have said, no, we're not going to hear it. This is what we're going to do. And that spoke very well of what we were trying to accomplish together. And again, thank you for that. It was a tough legislative session in a lot of respects. Well, you had a lot of issues, like you said initially, that was coming at you. Y'all were looking at big cuts.
Massive cuts.
Massive cuts. We knew that.
That's my area. My area is healthcare. Healthcare encompasses everything from our Medicaid program, veterans, APD, elders, and of course, child welfare and DCF. And that first 3 or 4 weeks, when we were based our budget off of an estimating conference from the really COVID, where Disney World was closed, nobody was coming to Florida. And my job, as you know, Kurt, from being at the time in the legislature, we have to have a balanced budget. We're only able to spend the amount of money that comes in. And when an estimating conference says we've only got that much, that's we've got to fit. So Doug Broxson is a friend of mine who does education. He's the education appropriations chair in the Senate. I'm health. Well, that's 3/4 of the whole budget. So when they looked at reductions, they looked at education and health to do those reductions. And it's never easy. It came at a time, Kurt. Why it's a double whammy then, because not only were we making massive reductions to hospitals and the child welfare, APD, all had these massive reductions. We expected more but more from you and your members as your costs to do business and to take care of kids and technology, they increased. So we got further apart. But as you know, Kurt, we had a happy ending as both the estimating conference came in, and instead of that much, we had that much. And then the federal government came in and gave us some one-time money. Now, Kurt, I want to this is an issue that we have to talk about and deal with. Although we passed a 100 billion for the first time, over $100 billion. We still are short in what's called recurring revenue. So all of that money from the federal government, we really have to put in infrastructure and capital projects and one-time use money. We were unable to use any of that in terms of salaries, of rates, of restructuring, of anything to raise anybody up over a period of time. When we met again with the Seminole Indian tribe and passed that gaming compact, that's going to be anywhere from $400 to $600 million, probably about a $500 million of recurring money each and every year. And then that money, I'm going to get into the ring and I'm going to fight our education chairs, criminal justice, the environment, which I love those things, but we want to make sure that those good gravy, the turnover in child welfare, I believe has significant caused by just salaries. It's not worth what we're paying these folks. So we're going to hopefully work to increase their salaries, not only the caseworkers on DCF, but your caseworkers as well within that realm to bring everybody up. We have a major problem, APD, all of the workers that contract out at the ARCs across the state and in the DD world, many of those folks are making $9 an hour. And you truly are an angel and doing the Lord's work, making $9 an hour and changing an adult diaper. It's just beyond, these are pure angels. And so we actually did some increases years previous, but when COVID hit, the governor felt the need to veto because we didn't have the money. But next year, we've got to address all of not only the issues that you've mentioned, but to come into compliance with our Constitution of raising salaries for the minimum wage increase. So couldn't come at a better time because gas is rocking. We just talked about airline fares. Everything is going up. And so certainly we want salaries to make sure everybody has the means to support themselves.
And that moves us to a great conversation around, you mentioned case management. That's probably for the money that comes into our system. It's a good portion of our dollars. It's a big number, and it's an important number because, frankly, turnover has a high expense. And, I was talking with the secretary about that as well, and past secretaries about that in their arena, but in our arena as well. And so it's an area that the coalition is going to try to, we're actually addressing at our leadership conference an idea as to how do we deal with that and bring real solutions to the legislature for your consideration next year, instead of just sort of saying, give us more money. We want to come in and say, this is a game plan. This would be a plan that would reduce the turnover, because turnover is just expensive. And it's a challenging world for us, and so we look forward to that. I was with Senator Broder, and he brought this up. He said, "Kurt, you guys have got to address this issue," and so we've taken on the charge for that. So I look forward to that this year, and we'll have some conversation.
I'm going to answer your question about how do we do things better. I just spoke at the Florida Palliative Care Coalition Association, mainly hospice providers, and they have ideas of how we can do better pain management and certain types of disease care. And that same question, we've got ideas. What can we do? And here's the best thing is, first of all, you've got to develop a relationship with legislators that they make the rules. And so now is the perfect time to reach out and either invite them to come speak to the board. I'm just telling you that they're looking for opportunities to be visible. Give them a shout out, tell them come have lunch with us, or take them to lunch, or invite them to come share thoughts and ideas. Give them a plaque, give them an award. They're looking for things to post on social media to let their constituents know they care about kids, care about you. So the timing is right now. It's summer. They're out. Everybody's out campaigning. And I'm on I call it the Rotary Tour, telling all the civic clubs exactly what happened during the legislature. So it's a perfect time. But the question came up, how do we do it? Well, what we don't do in health is override contracts. We have contracts with the CVC providers. We have contracts with managed care, and we're not just going to break a contract, but get a legislator to sponsor a bill that creates a pilot project. If we think this is the best way to handle certain situations, let's test drive it. Let's take the car out for a test drive. Pick one or two counties in different parts of the state that we can get some money, fund it, and then study it, because maybe, just maybe, that new idea and that test drive comes back with favorable results that we can carry forward throughout the entire state.
I love that people are hearing your heart, and really that's kind of the mindset of legislators. They're saying, look, give us what you've studied, give us some science behind it, give us some recommendation. It's versus that, when you and I served together, that was during the Great Recession, and everybody just came in and says, give us money, and cut them and kind of point that. And at some point in time, you just became hardened to that. Not that you wanted to be hardened, but that's not a solution. And so I think what you have just mentioned to many of our folks across the system of care, and it doesn't even have to be my members. I'm talking about people that are involved in just child welfare. If you care, get to know your legislators and talk with them and share with them some good ideas. What you just mentioned about bringing the thoughtful, wise ideas that come from studies and from a collective best practices is exactly where the Florida Coalition for Children Now with our members is what we're doing. We have a learning community that we're learning all together. And so our members are really coming together around that. We think that we are much stronger together.
Kurt, so legislators that when you go see, if that legislator is doing their job, they're going to be skeptical. I always say, sell me so I can sell others, because if that legislator doesn't ask a lot of questions, or you don't arm them with information, they're going to fall flat, because they're going to go into the legislature and we're going to compete. We're going to compete for attention, because there'll be 3,000 bills in 60 days, and you're fighting for attention. You're fighting for limited resources, limited monies. This past year, we had 3,145 bills introduced. That includes budget bills. That's House bills, Senate bills, that's everything. Some of them are duplicative. But that's a lot of bills and a lot of attention to fight for. But we've got to arm our legislators to go in there and then sell others to say, wait a minute, this is, if we're going to take care of kids, this is how we get it done. So that's to me, that's what I want. If people were coming to me with an idea of how we should do better.
That's fun, and thank you for saying that. And so I hope our folks are listening to that. I know they are. And so this is going to be, and we're trying to come with a collective voice. In other words, not have a whole bunch of different things coming around here, and we're going to try to come in with really a collective voice, and then to bring ideas for leadership. I think the Senate staff, Wilton Simpson's staff director, basically said, if you would bring ideas to us, we would greatly consider it. So we heard that. We appreciate that. That was very wise to say it that way. And quite frankly, we're going to do that. So,
Kurt, I'm going to give you something for your next sermon. And I used it at that hospice convention because they just created a new coalition of bringing in different facets of not only hospice, but just healthcare in general. And I took it from somebody else, and it's an old saying of, if you want to go fast, go by yourself. But if you want to go far, bring other people in for a lasting effort. And that's exactly what the Kids Coalition is all about, coming together, because we're in it for the long haul. We're not, there's no term limits in childcare. We've got a long-term focused and a long-term mission. So certainly I salute you for.
I just got off the phone with Hall of Famer Derek Brooks from the Tampa Bay Bucks.
Fantastic.
And he's going to speak at our conference, and we were talking about teamwork and togetherness. And so he almost got me to amen. And when he started telling me what he was going to say, we're excited about this. But and it was all around coming together. But see, I look further than just my people coming together. Coming together is coming with you guys. If we're all saying the same thing, then it's just a matter of how do we accomplish it. Recognizing finite budgets, recognizing that you have to get other people on board, other stakeholders. See, we're going to go even further than child welfare. We're going to be looking at a whole bunch of folks all out here in the healthcare and social welfare world to work together, and instead of siloing a lot of this. And so we think this is the right direction to go. And again, hearing from, I'll mention Kathy Mears, saying to come and bring us thoughtful plans. Man, I love that. I think that's a wonderful suggestion. And we're going to do the best we can to try to do that for you. So, well, as I'm wrapping up here, brother, I don't want to take all your afternoon. This is great. You and I could talk for a long time together. I appreciate you. Anything that you see, just particularly that you want to communicate to our members, or anything that you see that for this upcoming session that we should be preparing ourselves for? I did mention that we're looking at the case management and how we can do some more sustainability. Workforce sustainability, workforce development is critical in this arena, and that between the case managers and over in the DCF area, their CPIs, maybe the two most difficult jobs in all. That's and that's why we have a high turnover. We've got some really great ideas we're starting to work on how to hang on to these folks, develop them, and make them have a lasting career in doing the work, doing God's work, I believe, in taking care of these children and families. That's an area that we're going to be coming. Anything else that we ought to just be, some things that maybe from even last year that you thought we ought to maybe address a little bit?
Well, money's going to be an issue. Money is going to be an issue. And again, everybody, you can't name an area of state government that's saying, whoa, you give us too much money. I mean, everybody from teachers, and I think everybody has an argument. The environmentalists saying, hey, we need to put more money into Florida forever. The criminal justice system, we need new prisons and better prisons. A prison guard is at the correctional officer, $33,000. So everybody needs to address it. And hopefully we're going to have resources where we can lift all of those boats with a massive lift in the tide. So, but regardless, we just always need to be engaged. It's just a never-ending engagement. Here's something that changed my perspective more than anything, and I guess it's been, I don't know, 6-8 years ago. Children's Home Society invited me for a ride along for an afternoon, just a couple of hours. and with a caseworker, and it was very eye-opening, where you go right into in-home visits and visit. So that's something that all of your members, if you haven't done it, invite a legislator or even city councilmen or people, county commissioners, people in your area to just raise the level of awareness of what the mission is to protect these kids.
Well, and as you said, when they do that, they get a better understanding. And when they get a better understanding, they understand why you're asking for the dollars. And then it gives you an argument to be able to say, no, we need to make sure that this happens here. And with everybody competing for that. Senator Bean, you are not only a statesman, but you have a real heart and a passion for children. I know it. You have demonstrated that throughout your life. In many of the works that you do, and you've been a major supporter of child welfare, and it means a lot to us to have you on our program. And so I want to just say, with all of that, thank you. You have your tenure, both when I served with you in the House and through that time, and then stepping over in the Senate, has been a time that you have focused in this area. We're so thankful that you're the chair of appropriations, healthcare appropriations. That means I have somebody that at least is willing to hear and listen to our concerns and understands it. And that's a big deal. So thank you, brother. We appreciate you. Any closing remarks?
Kurt Kelly, what a wonderful time it is. I just want to say you do have a radio face, a face for radio. So I'm kidding. No, you've got a voice that is, again, as I began just to hearing your voice, it brings back great memories of serving with you in the Florida House. But I appreciate the time today and for your members. And Kurt, let me tell you, I want to tell your members how passionate you are. And I don't know if behind the scenes they know how much effort you put. You make everything look easy, but for your members, they are lucky to have you at the helm, herding everybody together and getting everybody to march in the same way for kids. So I salute you, my friend, and always look forward to our paths crossing very soon.
I'm confident you're like me, that you enjoyed that interview. It's wonderful to have such great leaders and to have them understand what it means as we work together to nurture well-being in the state of Florida.